Hey guys, my name is Joe. I am a healthcare professional and I wanted to take some time to talk today about my experience with COVID 19, having been a person that has it, now has long haul syndrome, and also as a healthcare provider, trying to help people navigate through the world of this whole crazy thing that we have. I wanted to take some time to share my reflections. I do need to say that nothing I say should be misconstrued as any kind of medical advice. It is simply partially my opinion, partially what I see from other people, partially the research that I've read from, well vetted, peer reviewed sources, and partially as my own work as a public health researcher. So the first thing that I want to tell everybody is we're apparently crazy. Like, we're all crazy. This whole thing has made all of us nuts. I'm sorry if y'all don't like me saying that. I don't care who you are or how grounded you think you might be. This whole stupid thing has thrown us all off kilter. Okay? We're all, like, not right in some form or fashion. Do not deny that. Accept it. Accept it because it is. Doesn't matter what side of the political fence you're on or anything like that. Doesn't matter how educated or uneducated you are. We're all not right from this thing. And the way that we've been behaving about this, we are cutting our nose off to spite our face. We are in a pit of quicksand, struggling so hard to get out and digging ourselves deeper holes. Okay? That is the fact. I say this as being a person that has been working in healthcare for 27 years in all different kinds of capacities. Having been a patient, the mother of patients, the wife of a patient, the daughter of patients, friend of patients, the nurse providing care on the floor, the medical assistant in the urgent care clinic, the CNA at the nursing home, the patient care assistant at the hospital. I've done all of those things. I've seen it all. I've heard it all. I've been around so many people. It'd take me an hour just to list it all. We are acting very crazy right now, and it has to stop. The hatred has to stop. This division that we're doing, well, vaccinated, not vaccinated, had COVID, didn't have COVID, eats salads versus eats cheeseburgers, all this division crap has to stop. If we're going to find solutions to this problem that we have, which is clearly a problem, and it doesn't matter where you think it came from or how it happened or whatever, it's a problem. It's a problem for all of us. And the hateful, divisive rhetoric has to stop. That is the antithesis of mature, appropriate scientific debate. If you're a healthcare professional listening right now, this has to stop if we are to uphold our oath of practice. It doesn't matter what specialty you're in. I don't care if you're a neurologist, pulmonologist, cardiologist, endocrinologist, GI specialist, ER doc, nurse on the NICU floor, dietitian, health coach. No, we have to stop with this madness of just throwing things at people because that is the prevailing thing that a group of people over here says. We have to stop doing that. We have to stop treating our patients poorly. We are failing them. We are failing them at an alarming rate that I could never have possibly imagined as a young clinician. We have to stop treating people like they're imbeciles. Yeah, there are some differences in learning. There are some different ways that we as providers have to adjust our communication in order to speak to people in such a way that they understand what we're talking about. But we don't need to be treating people like they're toddlers and making decisions for them because we decide they can't make the decision themselves. And so we coerce them or push them in a certain direction. We have to stop doing that. We have to work on our communication skills. And clinicians who are really good at what they do have the skill of being able to help what the Bible would say is the least of us. I'm not a religious person. I just happen to know some stuff about Bible verses. We have to be able to help the least of us. And that means that you have to take this very complicated language that is actually, quite frankly, a lot of fluff and ridiculousness and confusion-y type things, break that down to a person to where they can understand it. Don't just make the decision for them and then tell them in silly terms why you made the decision without giving them any explanation of why and the ability to actually make a decision. We need to go back to the fundamental basics of science and medicine. And we have to stop saying, well, this isn't possible. Really? And how many other things have you seen in your healthcare career that were totally not possible, but definitely actually happened? Because you have the documentation to support that. You have your eyewitness account to say, this happened. I know it's crazy, but it definitely happened. So stop saying that things aren't possible. And when it comes to COVID, it's extra bad for y'all to be saying, well, that isn't possible. We are seeing thousands and thousands of reports every day about weird stuff that's popping up. For me, in what I do, I work with diabetes people. I have a very dedicated group that I'm in that's 8,400 people. Before COVID, we had around 5,000 people. Since COVID, we've had, 24 or 3,400 people. Sorry for my mouth. My COVID brain doesn't work right sometimes. I can tell you with relative, pretty good, I think I'm right about this, that we have probably had somewhere in the range of 8 to 1,200 people in our group report in some form or fashion about either developing new onset diabetes or having an inability to control their numbers. And that goes for post-infection versus also vaccination as well. I know that's an unpopular opinion. I don't like it myself, but it's there. And for us to be telling people when they show up to our place of practice, well, your EKG's fine. You have anxiety. It's anxiety. No. No. In my own case, I got up one morning. I was certain I was going to lose consciousness. And I tried all my tricks, all my different things that I learned in nursing school about how to, fix the vagal nerve system and things like that. Essential oils and hot cloth or cold cloth and fresh air and a fan blowing on you and sit down or lay this way. I tried all the things and I thought I was going to lose consciousness, and I had to hold on to the wall and ask my husband, who was still sleeping, to take me to the ER because I had no idea what was happening. And there was nothing that I could think of that was happening. They admitted me because my blood pressure went down to 90s and 50s. My heart rate went up to the 160s. They couldn't figure out why. They treated me with aspirin, thiamine, Pepcid, and fluid. Those things don't fix anxiety. So we need to stop telling people when they show up with these symptoms, these random things that have suddenly started happening to them. We have to stop telling them they're nuts. Or, oh, anxiety, depression. No. Sorry, no. We need to start paying attention. And we need to understand that we might not find things we're looking for on the first pass of diagnostics, first assessment. And this crazy disorder changes the way that it interacts with your body. In my case, it went from neurological symptoms to gastrointestinal symptoms and some really weird crap. We need to start using our fundamental skills, our critical skills, first of listening, then of the comprehensive assessment, then of the critical thinking and putting the listening part and the assessment part together, and our scientific knowledge. How come I know this, and I'm not a physician, and y'all aren't paying attention to this stuff? I get that you're overworked, and I get budgets and all that stuff, but at the end of the day, that none of that's a valid excuse to do a disservice to your patients. And we're going to have a lot of people coming through the doors asking for help over the next bit directly related to this pandemic. So what the hell are we doing? Can we please start listening to people? Can we please stop attributing symptoms to, pseudo symptoms? Because that's not how it is. And I know it because I'm living it myself right now. And I'm also watching other people live it too. COVID is a challenge. And there are some people that seem to get better, within a few months. And there are some of us that still have lingering symptoms 2 years later. And I am one of those people. I first got COVID late February 2020, right before, they called pandemic. And I, as a, former nursing professional and everything, I was like, I don't know what this is, but I think maybe we have pneumonia or something. I listened to my kid's lungs and I was like, oh my God, this is terrible. And we went in and they're like, flu maybe. And I'm like, well, we can't really do anything with the flu at this point. It's been too long for Tamiflu to be effective. And plus my kids can't take Tamiflu because they have epilepsy. That's a confounding factor as far as our household is concerned. And he said, just keep treating it like you would. And I said, I'm worried we're going to get a secondary infection. Don't worry about that. Just call us. Well, 3 days later, secondary infection, of course, popped up. But it took us a while to get over that. And I seemed to be okay for a while, and then started having significant increase in muscle pain and joint pain, upper respiratory symptoms, gastrointestinal things, neuropathy feeling, things like that. And it was November 8th that I had to go to the hospital, and I was admitted because they were like, whoa, something's wrong, we don't know what. And that's when they treated me with the things that they that I mentioned before. And then and then I had a car accident November 25th. So it was like November 8th, I was in the hospital for these crazy symptoms. November 25th, I had a car accident. Broke my foot, hit my head, and that took a while of recovery. And then I learned about autoimmune conditions, and I learned about nutrition and low histamines and all that kind of stuff. And so I implemented that, and everything seemed to be sort of getting okay and, feeling better and so on. And then got COVID again in August of 2021. And that was a doozy. We had to go to the hospital within days of having this infection. But this time it was my other child that had the respiratory thing where I was like, oh my God, do you have pneumonia? And I couldn't breathe. I couldn't get out more than 5 words in a sentence. And so we went to the ER. They tested us. And the nurse practitioner said, well, your rapid test was negative, but your C-reactive protein is 40. Here's a steroid shot. She was like, where do you want it? And I was like, I don't want it at all, but okay, do the leg. And I let my kid watch because my kid was right there with me. And I'll tell you, the steroid really did help significantly. Like within an hour-ish, I started having some improved breathing and stuff like that. But the long haul symptoms after that have just been terrible. And I guess my overall point to healthcare providers is this is not anxiety, y'all. Come on now, we know when we're anxious about stuff. This is not it. This is a dysautonomia. This is an autonomic nervous system dysfunction, syndrome, disorder, whatever, inflammation process, whatever the heck you want to call it. This is a real thing. It exists. If a patient comes to you and says, I think I might have myocarditis, don't just be like, no, you read too much. Do the workup. Listen to them. Tell them you're going to try to help them get to the bottom of how they're feeling. And do not think that you can make such a judgment call in 8 minutes of time. Because no, I'm sorry, you can't. And I'm probably going to get lynched for everything I just said. But you know what? I don't care. If this is the hill that I have to die on, then I will have lived my life doing something meaningful and valuable. For those of you out there still suffering, I promise there's the capacity to get better. But we have to figure out your specific individual case, because what happens to you is not going to happen to Betsy Sue down the street. Some of us have more of the neurological symptoms. Some of us have more of the gastrointestinal symptoms. Some of us have more of the cardiac symptoms. Some of us may have more of the kidney, renal symptoms. And some obviously have liver symptoms. It's all so many and varied that at this point it is virtually impossible to say what specifically to do, except to try to reduce the inflammation as much as possible. That can come from diet, that can come from certain over-the-counter medications, that can come from prescription medications, which only your doctor can give to you. It can come from some vitamin supplements. It can come from mindfulness activities. It can come from breathing exercises. For some people, physical activity is a great thing. For some people, We do not want you to do physical activity. It seems to be that those that have more of the cardiovascular and some of the neurological things, we don't want to do a whole bunch of, exertion-y type activity because we're trying to keep the heart rate stable and the, nerve conduction stable and things like that. But for other people, maybe some exercise would be in order. These are all things that you have to talk to your provider about, and I hope that your providers will actually listen and put on their brain and remember the fundamentals in terms of the physics of medicine and, like, patient positioning and, exercise physiology type stuff and, the balancing of the natural, vitamins and things that we're all supposed to have, and understanding how the immune system works in the specific patient that you have in front of you. So, that's all I have to say about that. But I'm going to keep doing these videos as things pop up to me and as my own personal cognitive function continues to have good days. And I'll even share when I have bad days as well. But I want to start documenting this because I see a bunch of other people being real brave and doing it, and it's something that I need to do as well. We all have a story to tell, and the more of us that tell our story, the more everyone else can understand. Some people will never understand. Some people will be completely resistant to anything we say at all, whatever, because they have decided they know what's what, and that's it. And that's family, and that's friends, and that's healthcare providers too. And I hope healthcare providers march away from that stuff because that's outside of what they're supposed to be doing. But anyway, time for me to go figure out what to eat for lunch so I can nourish my body and continue feeling good this day. And I hope that all of you have the best day that you can possibly have, and I keep you all in my thoughts and prayers. Coach JJ out.